Hi YouTube, this is Jam and Eggs coming to you today, and I wanted to do something that was a little bit different than my norm that I do. Um, so previous when I did my, I guess welcome back video probably a couple of months ago or whatever, um, I told you all that I've been so busy that I really didn't have a lot of time to do videos like that. So I did do a video and I never put it up because I didn't have time to edit it and put it up. So look out for that one, previous before that one, in reference to the facial. And then hopefully later on tonight I could do a video about my hair because it's time to wash it. But anyway, um, so like I said, I have been busy and I've been busy doing school. So I my crazy self decided to go back to school to be a nurse, and so therefore I do watch YouTube videos here and there to get some type of help, motivation, and see what else is going on with other nursing students because it's like its own little clique in a way. So anyway, today I wanted to do what's in my nursing bag. This is my bag that I take to clinical um, sites, and it has all the nitty gritty stuff in it that helps me out through my clinical experiences. So I wanted to share this with you all, for those people that are interested in nursing school currently, that could possibly help you, or even you just want to be curious. So getting into it. Um, this used to be my bag. It says Love Save Japan. And it's just a little canvas bag. I got this from one of my girlfriends. She just happened to just give it to me. And who was this by? This is a J. Crew bag. And like I said, she gave it to me one day when we were at school. And it helped me out because I needed a bag because we started bringing more and more stuff to clinicals. But because it's near the end of the semester, it'll be April and just next week. And we're doing more stuff, and like I said, it's near the end, so therefore we're doing a lot more care plans and everything. So I needed more books, and I've been exposed and am being exposed to different and new diagnostic procedures and diseases. So with that being said, I needed more books. So books means more carrying. So I did buy this bag in particular for another use, but it just so happened it works out. So this is a book bag, and it's Hello Kitty. It's just a polka dot bag, and as you can see, it has the big old Hello Kitty face and a bow. Yes, this is an actual bow, and it says Hello Kitty down here. And it just has a regular compartment right here where you can put your pencils and stuff at, and of course the zip part. So I want to show you what's in the bag, but I do have some stuff that I transfer back and forth from my bag to my labs and on outside of clinical sites outside. So anyway, this might just be simple stuff to you, but some people don't even think about stuff like this. So I'm just gonna take it out. Okay, so lotion. Being a nurse, you'll be surprised how much you wash your hands, and also, in the medical field, you wash your hands a lot. So this is something that I got that I thought about, but I really didn't think about because I always keep lotion in my car. But lotion is key. Make sure you put lotion on before you go out into the elements, especially because it's still cold. And so lotion. You want to make sure you have a good moisturizing one. This is just having to be Johnson & Johnson. Lip chat. Yes, Carmax is my best friend during the winter. I always try to have some type of lip chat. I don't like the ones you have to use your finger while I'm at the clinical site because, of course, like I said, you wash your hands so much and you keep touching stuff and you don't want to put that stuff on your lips with your fingers. So I will recommend, of course, doing something where you could just top off and just apply. And of course, make sure it's be small and convenient. Pen light. Um, I just recently bought this. I had an older one where it was like you had to pinch it. And that one was dying out. But this one, I just bought this off of Amazon for like $7. And this one is, I can change the batteries in it. So it works quite well. So pen light is the most important. Scissors. Again, I bought this off Amazon. I think this was like $3. You want to make sure you don't hurt nobody, so get these type of medical scissors. So that's that. Pens, pens, pens is very important. I have 4 pens, the other one's in the other little compartment. But I always try to make sure I have enough pens because you'd be surprised how people go to clinical sites with only 1 pen and that pen conk out and then what? So I always try to make sure I have pens. And I just happen to buy these pens, like these are some crazy funky pens, which I know will be mine. So if anybody tries to take it, I'm like, no, those mine because nobody else have these. And these come in, I have zebra, I have tiger, I have giraffe. Yeah, I think that was it. So those are the prints. I got these from the Five Below store, and they write really well, and they've been working good so far. And this is just a regular pen that I bought from Staples. Okay, watch. I have only a specific watch just for clinicals. This is extendable armband wristwatch. I got this from Target. I think like $30. It's a man's watch because I have bigger wrists. But also, I didn't find too many women watches where you have this type of armband. And I got this type of armband, so when I put it on, it's easy on and off. But also, I can push it up out my way. So if I'm doing something that requires gloves to go further up my wrist, I try to make sure I get something like this. And it's easy, like I said, to come on and off. And then plus, you always want to make sure you have a watch that has the second hand for you to count, and it's readable. And also this watch has it where it's the date. I don't know if you all can see that. It has the date. So the day of the week, which is today, is a Wednesday, and then the 27th. So that's pretty cool. So that's why I got this watch. And I have plenty of alcohol pads. I do keep these in my clinical bags because you have to clean your stethoscope all the time, clean patient's arm, and I just want to I just grabbed this from the hospital. No, I'm not selling because I'm using it actually at the hospitals. And you don't want to keep running back and forth to the nurse's cart, so I just grab them and put them right in my pocket. And so, alcohol pads are very important. My stethoscope, and this, I just wrap this around. This is just, I seen this idea and I thought this was great from one of the girls. Just your hand sanitizer, because sometimes you might be in the middle of, again, doing something and you need to clean your hands. So this is pretty cool. I got this from the Five Below store and it smells like vanilla cupcake. So that's pretty cool. And I just bought this stethoscope, just a $15 one from one of the medical supply stores in my area. Something else is my school ID. I'm not going to show you who it is, but it's my school ID, and we have to wear our name badge with it. So, and you always want to make sure you have one with a retractable clip. But yeah, this is my school ID. So, because one clinical site requires your school ID, and my other clinical site requires the hospital issued ID, which I will show you. Unzipping it. And this is the one that's the hospital required. And again, I'm not going to show you, but this is the hospital required one. And so what I'll do is I'll just clip this one. If it works properly, I'll just clip this on this little plastic part so it just hangs both together with my face on it. So something else that I found very important that might be important for anybody, male and female, is that I always have my phone with me. I always have it because I never know when it's going to be an emergency. So some people leave their phones, but we leave our bags exposed, where it's in like a conference room or it's in like the nurses, um, like lunch room, and anybody can go in and out of there. It's not locked. So therefore, I like to have, only thing you will not see on me that I'm showing you, I even have my car keys in my pocket. I do not leave my car keys in my bag. Those are even in my pockets. I have a lot of pockets, fortunately, in my top shirt. So I don't have the pants, the cargo pants that have, the pockets, but I have to buy some. So therefore, when I do go out and start working, I will have the cargo pants so I can put extra stuff in there. But like I said, this is my phone, and I bought this off of Amazon for like $5. But it's my phone. I have the S3, but it's my phone, and then I'll put my ID. Oh, what's this? Oh, movie ticket. But I'll put my ID and my debit card in here, and I always try to keep that. Or even if it has a little section right here also, where you can put your money. And I got this because I had my Coach ID wallet case, and then I had my phone, and it was like it was just conflicting. So I was like, this is crazy. I've seen it on Amazon when they have it where you can carry your cards and your phone. So that's what I have, my cards and my phone. So this is a great idea that I recommend to both male and female, because it doesn't matter. They have it in different colors and everything. So they have it for your phone. I seen the iPhone has it. I don't know about any other phone, but you can always Google it. So this is a great idea. And I do carry my headphones with me. And this is just my way of like mentally dumping everything before I go into clinical sites, or even leaving out clinical sites, because sometimes I just need inspiration going in. I need to get myself hyped up, because you have to be there bright and early, ready to smile at 7 o'clock in the morning. And sometimes I'm just like, I just want to go to sleep. So, great idea. Alright, now to the books. Something that I always have in my pocket are these two things. This is a drug book. This is something, it's a pocket guide, which is perfect because it's so small. And I got this from off of Amazon. I can't remember because I bought this sometime early last year. Not early last year, but late last year. Like for the fall semester. So I don't remember. But that's that. This is I don't know how to pronounce that. But that's it. And just to be cautious about this one, it's just like they do a lot of abbreviations, or let me show you what I'm talking about. For example, a lot of people don't know what these things might mean. So I'm trying to give you something. Like, for example, people might not understand what the abbreviations might mean in medical terms. So they'll do that in this book also. So like, for example, for a change, like a change in temperature or a change in blood pressure, most people do like a triangle. And they'll write that in here too. So that means change. So if you can see that, that's like a triangle. That means change. So they'll do a lot of abbreviations. So that's why it's so condensed. And this is what a page might look like. It's very informal. Informational. So this helps. And this is a book that I had for a long time ago. It was just a little notebook. And I recommend something that you can get and put it in your pocket. Don't get like the big old ones, because it's not even worth it. Also, something I recommend is making sure you have index cards for your drug cards. These are my drug cards that we normally go over. And if I need to put some more drug cards in here, but it's more drugs that I have been exposed to that I don't know. So what I'll do right there at the clinical site, I make sure that I just bring out a new index card, and then I'll start writing from my pocket guide. And when I'm doing report to my instructor, I try to make sure I I know what the drug is, side effects, and you know the usage. But you also want to make sure that you always are well prepared when you're doing your you're getting report, and make sure when you're getting conferences with your instructor, even with some of the nurses, they're going to ask you a lot of questions. And so whenever somebody is telling you something, you always want to make sure you have your pen and your paper and you're like this, you're ready. A lot of times I've seen people how they listen but they don't write down, and I don't understand how you can retain that. Some people have good memory where they can remember what the person is saying by looking at their movement of their lips, facial expression, whatever. But I just feel like years later, how can you reference to anything if you can't even remember what you didn't write down? So make sure you're always ready to write. Pen and paper always. So these things are something, like I said, I always make sure I have in my pocket. Okay. This is a book that was required for us like last semester, but we never even used. But this is something that is also good. This is the Jarvis Physical Examination and Health Assessment. And this is good because it gives you it breaks down each system, and it gives you like a head to toe, like how to assess the patient, and you know, things that are normal and abnormal. So for example, let me give you this one. Like this is like the abdomen, and it shows you great pictures, and it shows you like, you know, the organs that's within the abdomen, and then it'll tell you like how to prepare normal findings, abnormal findings, like how you're assessing, like physically assessing, like you're looking, and even how your percussion and palpation, how it should sound and feel. So yeah, it's like, you know, it breaks down each one, and this is pretty good. I think I paid like $40 for this, but like I said, this is something that I had last semester, and I'm still using it this semester. I haven't used it as much, but it's good to have. So this is in my book. I just bought these two this past week because somebody exposed me to them. To two different people exposed me to these, and they helping out greatly. This is the maternity and newborn nursing, and then this one again. This will break down. Like for example, this is postpartum, and this will break down. You know, you as a nurse, what you're assessing for. Like some of the patient's needs, safety alerts, complications, newborn safety, infections. Like it tells you a lot of stuff, and like even it shows you how to help the mother nurse and everything. So this is great. Now the other book I have is Medical Surgical Nursing, and I have the big old thick textbook to this. And I don't know, I didn't like med-surg at first, but I'm starting to gain appreciation to it in order for me to appreciate this, because this is where I want to ultimately be. But anyway, for the medical surgical nursing, this actually, I seen this, like I said, last year with one of my classmates, and I was like, oh, okay, whatever. But this one is really good because this actually breaks down diseases and how a patient should assess and intervene with the patient. So for example, this is dehydration, and it has on there like for example, consideration for older adults, how to assess it, basically like the whole plan of nursing. And interventions, and what do you think that your overall outcome might be. So this is really going to show me how to do a nursing plan, but like I said, this is even good for things that I'm not even familiar with, so that's really good. And oh, this was I bought both of these off of Amazon. I think $20, and this was $32. So it's an investment, but it'll help me because I have a whole another year of nursing school. And the Jarvis, like I said, was $40, And I got this, I think, off of textbooks.com. So that's that. Okay, that was crazy. And it's another one. This is the nursing diagnosis book, and I got this from one of my girlfriends because she's a nurse. She doesn't need it anymore. And this is old. I want to say this is 2006. But it still works because it's a lot of still the same nursing diagnosis, and it has helped me. But they do have up to date ones, but I can't afford it. I can't afford like $50 books or something crazy. So this is something that actually helps me out when I'm doing nursing plans. And last but not least is my folders and my clipboard. I always carry my clipboard with me at clinical site because we have papers that we have to fill out on site, and while we're there, like I need to, like for example, this long piece of paper right here, this is how I get report and how I give report. So it just breaks down, like for example, it has on here the room number, name, diagnosis, like if they had any surgeries, allergies, and the doctor, and then it's just a assessment from like head to toe, and like any complications, labs, or previous history. That's what it was. So it's just like all this, and as you can see, like I'm almost, yeah, I'm done with this side, so I have to do this side next week. So, and then this folder here is my yellow folder. I keep in here like previous documents that I had from the semester, and then I have a presentation coming up, so I have my presentations that I need to pass out. So that's that. So I hope this helps. Like I said, it helped me when I looked at some videos, and I hope it helps you. If you have any comments, questions, or concerns, especially I know me personally, I had a lot of questions when I first started nursing school. I didn't know what to do, who to talk to. Luckily, I have friends that are nurses, but if it wasn't for them, I don't even know what to do. But all I can tell you, if you're very interested in becoming a nurse, is that nursing school is going to build you down and break you up. But also, you have to be well prepared. Like, you cannot just say, oh, I want to be a nurse and get in nursing school and then think it's going to be a breeze. It's not. It's a lot of sacrifices, like my social life sacrifice, my personal life is sacrificed, and even my financial and career is sacrificed. Like, everything is put on hold because this right now, I live, sleep, and breathe nursing school. And this is something that I'm going to have to do for another year. And plus some, because I'm trying to work my way all the way up to become a nurse practitioner. So that's more school. But nursing school is no joke. So I would recommend you always be prepared. Like, something that a lot of people always admire about me is my preparation. And it's because I wanted this for a long time, and therefore I have the opportunity, and I'm not going to let that go. So I will recommend you be prepared, and you're gonna have to stay prayed up. Whatever God that you believe in, or faith, religion, myself, I'm a Christian, so I pray every time I go to the clinical sites. So I recommend you do the same, because you're going to need a lot of prayer. You become very spiritual or religious in nursing school. So anyway, I hope you enjoyed the video. Thank you for watching. Peace and blessings.